patient after they sustain a traumatic brain injury is very different and unique. And here at Rehab, we really try to tailor our course of treatment to the needs of the patient. What you might typically see when your family member or the patient or survivor comes to Rehab is a whole multidisciplinary team really focused on getting your loved one better. And that team can consist of many people, but more specifically a physician who specializes in brain injury rehabilitation to manage the medical needs as well as the rehabilitation and complications that can occur after traumatic injury. There's a team of therapists. Those can consist of a physical therapist who works on your loved one's movement, their sitting, their standing, their transfers, improving their balance and mobility. Also, occupational therapy is involved. That is a therapist who focuses on the routine of life, doing the simple things such as washing hair, washing your face, getting to and from the bathroom, things that we so often take for granted that are the stepping stones to recovery after a brain injury. Included in the team is a speech therapist. This therapist mostly focuses in on the cognitive deficits that may occur after traumatic brain injury, working on language, swallowing, and getting started back on a nutritious diet. Also accompanying the team is that of neuropsychology. That's a specialist who focuses in on cognitive impairments and deficits related to brain injury. We also include therapeutic recreation. These are the therapists that get patients doing the things that they love to do, getting back to their community, getting back to doing tasks related to work and school. Our specialized nurses, most of which have had specialized training in rehabilitation after brain injury, and those nurses round out the team to make sure that the patient gets a comprehensive effort while they're recovering. It often takes the team assessing the patient to come up with this decision, and sometimes it takes more than a day or two to get to know the individualized patient. How we try to base our decision is based not only on their medical needs, but also their physical and cognitive needs. And we work with families as well as the patient and their payer sources to come up with the best decisions on how long the patient needs to stay in rehabilitation. So you've been told that your loved one has diffuse axonal injury, and that does mean that there's been injury throughout the brain. But when it comes to rehabilitation, we really focus on the individual patient and not so much what the imaging tells us. Sure, it can tell us certain parts of the brain that have been injured, and maybe we can correlate that with deficit, but we cannot necessarily say that that is going to impact recovery fully. So what we do with rehabilitation is we just begin on day one, and we start rehabilitation guided towards the individualized patient no matter where their injury occurs. Of primary concern for your loved one is when are things going to get better and how much better are they going to get. This is an impossible question to answer for many physicians and healthcare providers, as we have all had unique experiences in dealing with patients over the course of time. And what we typically see and what we typically will say to families is the quicker patients get better, the better we think they'll get. However, that being said, patients can continue to change years on after their injury, whether it be mild, moderate, or severe, and thus getting access to rehabilitation, access to your physician, and ongoing therapies is absolutely paramount and important in your patient's ongoing recovery. Rehabilitation after traumatic brain injury has many different levels. The first of which begins even while they're in the intensive care unit. This begins with positioning your loved one's arms and legs, providing movement to the limbs that they're maybe not able to move, as well as continued medical care and support for them. Then once things are more stable and the patient improves, their course moves to perhaps an inpatient rehabilitative unit where they get a multidisciplinary approach, meaning multiple therapists and staff and healthcare providers that can interact with your loved one and provide the care that they will need to help restore function and mobility, as well as the other areas of improving their cognition and swallowing. There are a number of options. Many of these are guided specifically to the patient, and These can range from receiving outpatient services where the patient is staying at their home and going to the office to receive therapies, and whether that continues to be physical therapy for maybe deficits with walking or moving, or speech therapy where they're still having difficulties with memory or thinking or swallowing. Oftentimes, family are confused about where to go next. The rehabilitation team will guide you into making these recommendations, but a variety of options do exist. When patients are ready to return to work, there's comprehensive evaluations that are commonly done by a neuropsychologist. They're able to do extensive testing and find out deficits that may still exist or that still need to be targeted before returning back to a full work day or back to school, or even more importantly, back to driving.